Ever wondered how surgeons can perform intricate procedures without causing pain to their patients? The answer lies in the realm of anesthesia. This fascinating field of medicine is the linchpin that allows for pain-free surgeries and procedures. It's not just about putting you to sleep. It's a carefully calibrated science that ensures your safety and comfort. Anesthesia, derived from the Greek words meaning without sensation, is a state of controlled temporary loss of sensation or awareness. It provides relief from pain and total or partial loss of consciousness. There are several types of anesthesia, including general, regional, and local, each with its unique uses and methodologies. General anesthesia, for instance, induces a deep sleep, while local anesthesia numbs a specific area of the body. Regional anesthesia, on the other hand, affects a larger area of the body, such as the lower half. Now that we have a basic understanding of anesthesia, it's time to delve deeper into the stages and principles of its application. Anesthesia isn't as simple as just making a patient unconscious. It's a process that involves 4 distinct stages. Let's start with the first stage, known as induction. This is the transition period from being awake to being unconscious. Anesthetic drugs are administered and the patient goes from a normal state of consciousness to an unconscious state. It's a smooth and controlled process designed to ensure the patient feels no distress. The second stage is the excitement stage. It might sound like a party, but it's actually the most dangerous stage of anesthesia. It's a period of delirium where the patient may experience irregular heart rates, blood pressure fluctuations, and uncontrolled movements. Anesthesiologists closely monitor this stage to manage these risks and transition the patient safely to the next stage. The third stage is the stage of surgical anesthesia. This is the goal of the anesthetic process, where the patient reaches a level of sufficient anesthesia for the surgery to commence. In this stage, the patient's breathing becomes regular, their muscles relax, and they are completely unconscious. The depth of anesthesia is adjusted throughout the surgery to maintain this state. Finally, we arrive at the fourth stage, recovery. This is when the anesthetic drugs are stopped or reversed and the patient gradually regains consciousness. Anesthesiologists carefully manage this stage to ensure the patient wakes up safely with minimal discomfort and side effects. Each of these stages requires careful control and monitoring by anesthesiologists. They use their knowledge of these stages, along with information about the patient's health, to tailor the anesthesia to the specific needs of the patient and the surgery. So, anesthesia is more than just going to sleep for surgery. It's a complex, carefully controlled process that ensures the patient remains safe and comfortable throughout their surgical experience. Understanding these stages is crucial for both anesthesiologists and surgeons to ensure patient safety. The application of anesthesia is guided by a set of principles that ensure its effectiveness and the patient's safety. These principles are designed not only to make the procedure as comfortable as possible, but also to protect the patient from potential complications. First, let's talk about patient assessment. This is a vital first step where the anesthesiologist evaluates the patient's overall health and any potential risk factors. It involves a comprehensive medical history, physical examination, and necessary laboratory tests. The goal is to understand the patient's physiological condition, which will guide the anesthetic plan. Next is patient preparation. This involves explaining the procedure to the patient, discussing the potential risks and benefits, and obtaining informed consent. It also includes fasting to empty the stomach, pre-medication to relieve anxiety and reduce secretions, and establishing access for fluid and drug administration. Then comes the monitoring phase. This is an ongoing process that begins before anesthesia is administered and continues until the patient is fully recovered. It involves observing the patient's vital signs such as heart rate, blood pressure, oxygenation, and level of consciousness. Modern technology like pulse oximeters and electrocardiograms play a crucial role in this process. Lastly, let's talk about post-anesthesia care. This begins as soon as the procedure is over and continues until the patient is stable and ready for discharge. It involves monitoring the patient for any complications, managing pain and nausea, and ensuring the patient's comfort and safety during recovery. These principles aren't just a checklist, but a comprehensive approach to patient care that ensures a successful anesthesia process. They are based on scientific evidence and years of clinical experience, and they are constantly being refined and updated as our understanding of anesthesia evolves. These principles are the foundation of anesthesia practice, but what about the drugs used in the process? Intravenous anesthetics are integral to the anesthesia process, inducing a state of unconsciousness in a controlled and safe manner. Now, let's dive into the fascinating world of these anesthetics, their functions, and their profound impact on the human body. To start with, the most commonly used intravenous anesthetics include propofol, barbiturates, and benzodiazepines. Each of these has its own unique mechanism of action, but they all share the same ultimate goal: to induce a state of unconsciousness, allowing for pain-free surgical procedures. Propofol, a milky white solution, often referred to as milk of amnesia, is used for both the induction and maintenance of general anesthesia. It works by enhancing the inhibitory function of the neurotransmitter GABA in the central nervous system. This action depresses the central nervous system, resulting in a rapid onset of anesthesia. Next, we have barbiturates, such as thiopental. These also act on the GABA receptor, but in a slightly different way, prolonging the opening of chloride channels, thus hyperpolarizing the cell membrane. This slows down brain activity, leading to a loss of consciousness. Benzodiazepines, on the other hand, like midazolam, are primarily used for sedation, anxiety relief, and amnesia before and after surgery. They increase the frequency of chloride channel opening, which results in an inhibitory effect on the neurons, reducing brain activity. It's important to note that the dosage and administration of these anesthetics require a surgeon's precision. Too little, and the patient may not achieve the required level of unconsciousness. Too much, and the patient could face serious health risks, including respiratory depression or cardiac arrest. This is why anesthesiologists are such vital members of the surgical team. They're the ones who determine the precise dosage and monitor the patient's vital signs throughout the procedure, adjusting the dosage as necessary to ensure the patient's safety and comfort. But remember, these anesthetics don't work in isolation. They're often used in combination with other drugs, such as opioids for pain relief or muscle relaxants for muscle paralysis. This combination, known as balanced anesthesia, helps to minimize the side effects and maximize the benefits of anesthesia. So there you have it, a brief overview of the pharmacology of intravenous anesthetics. These drugs, while powerful, are incredibly precise tools in the hands of skilled anesthesiologists. They enable us to undergo surgical procedures without experiencing pain or distress, which is truly a marvel of modern medicine. Intravenous anesthetics are just one part of the equation. Let's explore inhalational anesthetics next. Inhalational anesthetics are another crucial tool in the anesthesiologist's kit, used to maintain the state of unconsciousness during surgery. Now let's delve into the world of inhalational anesthetics. These are a group of compounds that are inhaled and absorbed through the lungs to achieve anesthesia. The most common ones include nitrous oxide, desflurane, sevoflurane, and isoflurane. These gases have been used for centuries, with nitrous oxide, also known as laughing gas, being one of the earliest to be discovered. The mechanism of action of these anesthetics is fascinating. They work by interacting with certain receptors in the brain, leading to a decrease in nerve transmission. This results in a loss of sensation, including pain, touch, and temperature, and ultimately a state of general anesthesia. However, the exact process is still a subject of ongoing research. The effects of these anesthetics on the body are manifold. Initially, there is a euphoric stage characterized by excitement and sometimes laughter, especially with nitrous oxide. This is followed by a stage of unconsciousness where the patient is fully anesthetized and ready for surgery. During this time, the patient's vitals must be closely monitored, as these anesthetics can affect the cardiovascular and respiratory systems. This is why the role of an anesthesiologist is so crucial. They carefully control the concentration of the anesthetic gas delivered to the patient, adjusting it as necessary based on the patient's response. They also monitor the patient's heart rate, blood pressure, and oxygen levels to ensure they remain stable. It's a delicate balance, but one that is essential to keep the patient safe and comfortable throughout the procedure. The choice of which inhalational anesthetic to use often depends on the patient's health, the type of surgery, and the anesthesiologist's preference. Each anesthetic has its own unique set of properties, advantages, and disadvantages. For example, nitrous oxide is often used in dental procedures due to its fast onset and recovery times, while isoflurane, with its potent anesthetic and analgesic effects, is more commonly used in longer, more complex surgeries. Inhalational anesthetics have truly revolutionized the field of anesthesia, making surgery safer and more comfortable for patients. Though they are powerful tools, they require a deep understanding of their pharmacology and a skilled hand to administer. With a sound understanding of these anesthetics, anesthesiologists can safely guide patients through the surgical process. Anesthesia is a complex and critical part of modern medicine, enabling pain-free and safe surgical procedures. Today, we've journeyed through the intricacies of this medical marvel, starting from its stages, induction, maintenance, and emergence, to the fundamental principles that govern its use, including the vital balance between patient safety and effective pain management. We also delved into the fascinating world of anesthetic pharmacology, exploring how intravenous anesthetics like propofol and thiopental work in the body, as well as the role of inhalational anesthetics such as isoflurane and sevoflurane. Each of these elements plays a key role in making surgery a bearable experience. It's a testament to the incredible strides we've made in medicine, transforming what was once a daunting ordeal into a manageable process. Subscribe for more because you won't find me later. Stay curious, stay informed, and we'll see you in the next video.